Wait, what is that? Why is it red? Why is it round? Why is it growing like it pays rent here? Pyogenic granuloma, peripheral giant cell granuloma, ossifying fibroma. These sound like boss fights.
Relax, Yasser. Let's see. Red, gingival, soft.
Doctor, be honest with me.
It's probably epulidis. Let me confirm something.
Yes?
Sir, I have a patient with epulidis.
Epulidis is not a diagnosis. Did you sleep in my reactive lesions lecture again?
No, sir. I was revising internally.
Wake up, Dr. Nayar. Epulidis is a clinical term. Diagnosis depends on the tissue reacting. Is it fibrous? Is it vascular? Does it contain giant cells? Does it produce bone? Or was it present at birth? Let us examine the 5 main types of gingival epulidis.
Epulidis is not a single disease. It is a clinical term that describes a localized growth on the gingiva. The same irritation acting on different tissues can produce very different lesions. To understand epulidis, you must understand the tissue of origin. Let's meet the 5 main types of gingival epulidis as 5 very different characters.
Hello, I'm fibroma, also known as irritation fibroma or traumatic fibroma. I'm the most common type of epulidis, and I form because of chronic irritation. Things like cheek biting, plaque calculus, or rough restorations. They stimulate fibroblasts to produce excess collagen. That's why I feel firm and rubbery, and why I usually look pink, just like the surrounding gingiva. I grow slowly, I don't bleed easily, and I usually don't cause pain unless I get traumatized again. I'm not a true tumor, and I'm not dangerous. Remove the source of irritation and excise me surgically, and I rarely come back. Hey, look at me.
I'm pyogenic granuloma. And yes, my name is totally confusing. I don't produce pus, and I'm not a true granuloma. I'm actually a reactive vascular lesion caused by trauma, plaque, or hormonal changes. I'm made of proliferating blood vessels, which is why I'm bright red, soft, and I bleed very easily. I grow rapidly, and that scares patients. But don't worry, I'm still benign. You'll often see me in young people, and especially in pregnant women, where I'm called a pregnancy tumor. After pregnancy, I may even shrink or mature into a fibroma. Surgical excision treats me, but if I'm removed during pregnancy, I might recur.
I'm peripheral giant cell granuloma, also called giant cell epulidis. I'm reactive, just like the others, but I contain multinucleated giant cells, which makes me different. That's why I look bluish-purple, darker than pyogenic granuloma. I appear only on the gingiva or edentulous alveolar ridge, and I may develop in the anterior or posterior regions. Sometimes, I even cause cupping resorption of the underlying alveolar bone. I'm firmer, heavier, and more aggressive looking, but I'm still benign. Complete surgical excision down to the bone, along with removal of local irritants, prevents my recurrence.
Hello, I'm peripheral ossifying fibroma. I'm a reactive gingival lesion, but I'm special because I can produce bone or calcified material. I arise from cells of the periodontal ligament, or periosteum, usually from the interdental papilla. I appear as a firm nodular mass, pink to red in color, and I don't bleed much. You'll most often see me in teenagers and young adults, especially females, in the incisor cuspid region. I don't affect teeth, but I do like to recur if I'm not removed properly. That's why surgical excision down to the periosteum is essential.
Hi, I'm congenital gingival epulidis. I'm born like this. I appear at birth on the upper gum, usually in baby girls. I look smooth, pink, and soft. I'm not caused by irritation. I don't grow fast. I don't come back. Sometimes doctors remove me so babies can feed better. And sometimes, I even go away by myself. 5 different lesions, 1 clinical term. Epulidis is not about the name, it's about which tissue is reacting. Understanding that difference is the key to diagnosis and treatment.